tender model of integrated care for people with Parkinson's disease, Alzheimer's disease, and other forms of dementia. Horizon 2020, and MOPID, New Approaches for Early Diagnosis of Alzheimer's Disease. He was a member of the committee of the International Conference on Dementia, organized by Spormincica. Okay, I told it.
Hello, nice to be here. I'm David Krivec, and Spormincica is flowers. It's the name of the flowers in Slovenia. So thank you all for participating, and I will talk about strategies and upgrade of dementia-friendly local communities in Slovenia. So the community and the environment influences how a person with dementia experiences the disease, as well as how carers live with dementia, and educating, connecting different stakeholders in the community, encouraging and setting dementia-friendly initiatives. Local communities are the core action for new national program, Integrated Dementia Care in Local Communities, that is co-funded by Ministry of Health. And Spominčica is leading this program in Slovenia for the last 2 years now. One of the main things is to reduce stigma still. So to reduce stigma of dementia and to raise public awareness, not only about dementia, but also about risk factors, and enable families to get enough information and assistance in a timely manner, we have started to design and implement this program, Integrated Dementia Care in Local Communities. This program is co-founded by Ministry of Health. We have partners in Slovenia that are clinics, neurology clinic of Ljubljana, 2 homes for elderly. Then we have a research institute and a community healthcare center. And the main areas where we are testing this program are local communities with higher rates of elderly people, so demographically deprived rural and urban areas. And in this program, we also want to upgrade the activities of dementia-friendly points and create the environments with create dementia-friendly environments. So a few words about the dementia-friendly points. This is a campaign that Spominčica started in 2017 with the Ombudsman of Human Rights. And in this program, we provide education and training for different kinds of organizations. We educate their employees so that they can provide their services in dementia-friendly way. They can share information about dementia and support local communities, and also share knowledge about dementia through their networks. Of course, they can also provide some directions to family members or people that seek for information about where to go for advice or for further help. The program, Dementia-Friendly Points, looks like so in this graph. So first, an organization expresses their interest. Then we perform a training about dementia that has topics like what is dementia, how to communicate with a person with dementia, how to approach in proper manner, and what kind of support, social and health support is offered in local community. Then we perform a public event. This is also very important. Through these events, we raise awareness in local communities. We invite media and important stakeholders in local communities. And we have also some cultural program so that the event is attractive to more participants. And through live calls of these dementia-friendly points, we perform evaluation the activities, their needs, the needs of persons in local communities, and provide additional trainings for members. In the program, Integrated Dementia Care of Local Communities, we have started with a study about life with dementia, provided services for persons with dementia and carers, and about the impacts of COVID, since we started this program during COVID period. So this was a cross-sectional qualitative study carried out with surveys in 2022. The first survey was for carers and members in local community, and the other survey was for professionals working in health and social care sectors. The survey was about public awareness of dementia, level of stigma, services needed, COVID-19 epidemics and related changes, and the needs on education and training. So, about the results. First is how the persons with dementia accepted COVID-associated preventive measures. We have experienced quite some trouble when persons with dementia didn't understand that things changed and they must change their behavior. So on the left side, you can see the answers of carers, and carers perceived that more than 2/3 did not accept well or accepted but needed additional help in through the times of COVID to respect the measures and to adapt to the new reality. Professionals' opinion was even more strict on how COVID measures impacted everyday life of persons with dementia. And they saw that persons with dementia had really a lot of difficulties in everyday life to manage their activities. Moreover, 32% of carers stated that the level of support for organized health and social services and services for independent living in their local environment was bad, or there wasn't any. But nevertheless, nearly half of the respondents stated that the support was good or acceptable and didn't change that much. Carers stated also that persons with dementia were less physically active in the last years, and a quarter of them stated that this was significantly different than in comparison to times before COVID, so that the physical activity of persons with dementia significantly lowered during the COVID period. And also 21% of the respondents, carers, stated that they had their sleep quality significantly worsened in comparison to the time before, and also that persons with dementia lost the energy to be included in the activities. So the effects of social isolation and restrictions resulted in a significant reduction of physical activity and sleep quality to persons with dementia and also carers. What were the main problems that carers and professionals noted to persons with dementia and to their life? We can see that mainly they have less time for themselves. They missed someone they could count on in providing help and assistance. They had difficulties in completing tasks. They also missed company of other people, and a lot of them felt overloaded with daily routine, how to provide everything during that period. They had also experienced emotions of sadness and worsened sleep quality, and also they felt that they are less physically active. So carers also stated that when we spoke about what kind of trainings they would need, they said that they would need to improve their knowledge on different types of dementia, symptoms and therapies, about communication with person with dementia and how to take care of a person in home environment with meaningful tasks, prevention of falls, and associated problems like continence management. However, they also felt they needed some more knowledge about how to take more care for themselves as carers. So there are several reports from Europe showing the devastating impact of this epidemic time on people living with dementia. And caregiver distress severity during this epidemic period was influenced not only with memory deficit and neuropsychiatric symptoms of patients, but they also felt hyperarousal and avoidance symptoms and worries linked with COVID-19, and they felt more depressed during that time. They felt that they had limited external support. However, we have also find out that the dementia-friendly spots network were able to assist them during this time, because through dementia-friendly spot, they had access to information and support in their local community where the support was more needed. We have also observed that the reduction of physical contact and social relationship in the carers' everyday life. So they couldn't get adequate social and psychological support. Their playful activities for themselves and also with persons with dementia were reduced. They felt isolated and overloaded with the daily routine, which probably led to the reduction of their emotional health. So it is clearly shown that in Slovenia, a lot of carers expressed their need to have the access to training and build their knowledge in several topics that we will provide through this national program. And as also we have found in other studies, we have observed that carers, even those with high resilience rates, should be addressed to psychological intervention to reduce levels of depression, anxiety, and caregiver burden. Moreover, with the results of the survey, and together with the result of the second activity, that is public health diagnosis of 4 pilot local communities, we have set the basis to design dementia-friendly environment in connection with the activities of dementia-friendly spots to provide better integrated care in local communities in Slovenia. So, thank you. And some questions?
Thank you very much, Mr. Krivec.